So good afternoon everybody, and welcome to the latest edition of A Chat with Caroline from Lancashire Care Foundation Trust. Just a reminder for those who are watching this live to leave your questions during the next 20 minutes or so, and the panel will do their best to get their answers to you while we're live. I'm now going to pass over to Caroline. Hi Caroline.
Hi, thank you very much indeed. And welcome everybody, and thanks ever so much for taking the time out of your day, just for probably 15 minutes max, just to have a chat and really to hear your thoughts and views around the theme this week. So the theme this week is around our management of change, of moving to locality working, so that I know a lot of people have got lots of thoughts and views about. Just before we get to that, I just want to give, as I always do, just a little bit of an update of what are the key things that have been happening in the last week or so. So today is the day, folks, that we believe our CQC report is going to go live. We've already thanked particularly our dental services and our children's inpatient services for the fantastic services that they are delivering to our communities, so really well done. Particularly really well done to dental services, who got outstanding for caring, and a big well done to Cam's Cove, who managed to improve from requires improvement to good in every single domain. So really great, and those results don't come without teams working really well together and being really responsive to service users and carers. And then we know that we've got 3 really quite challenged outcomes for our adult acute pathway. And hopefully people are aware that we have a significant improvement plan that we've been working on for the last few weeks. Now, some good news around that. One of the most important ingredients of that improvement plan is that we get more staff working across our services and have some new services as well. And to be able to get more staff, we need more money. So we are really pleased to say that we've been successful with getting significant extra funding from the national team, so thank you very much to Claire Murdoch and teams. And we've also been successful in getting significant extra money from our commissioners, CCGs, but also supported significantly by the ICS. So again, a very big thank you. Really important partnership working that's happened in the last few weeks. Of course, we have already started a campaign to increase our staff, and the big role that you can all play is helping to attract staff to come to the Trust. And I understand that it's not necessarily always been the best place to work, but we're really ambitious in the future that it is going to be a really great place to work, where people will be able to have joy in their work, come to work, feel supported, feel developed, and want to stay here. So anything that people can do around attracting friends or even family or colleagues to come and work here, we would be really grateful. So the next thing, just in terms of partnerships, that I wanted to just mention to you is the really excellent partnership that we're developing now. We've always historically had partnerships with the police, but that really is going from strength to strength. And this week I had a really positive meeting with the Chief Executive of Lancashire Constabulary, Andy Rhodes, and together we really do believe there's a lot more we could be doing in partnership. And again, I know that there's lots of examples across the Trust where people are already working well together, particularly in the Synergy vehicle in Blackpool, and really well done. There's more we can do. In terms of the number of people that are coming through our 136 suites, they're as high as ever. So more work with the police will hopefully help us to direct people away from 136 suites where it's appropriate. But in spite of them being as high as ever, we've done really well in August in reducing significantly the number of people that are waiting over 23 hours in a suite. So again, really big thank you to everybody. But we have more to do. And what the general reason now why people are waiting for long periods of time is because we have got a gap in terms of our beds. So just to remind everybody, we are partnering with the private sector and with our NHS partners, and we've also going to have new beds opening in Preston in about February time. And at the moment we're working on the case for new beds in the Fylde area as well. So again, thank you to everybody for that work. couple of other things I just wanted to mention. Firstly is that we've got the Health and Safety Executive with us this week. This is part of a national programme. It's not a targeted visit, particularly to our trust, but we hope there will be lots of learning for us from this, particularly thinking about the well-being of our staff and really looking at how we're looking after staff and their health and well-being, particularly often people are in very challenged clinical situations. And as you'll know, one of our listening into action groups that we're about to have big conversations during the next few weeks is around health and well-being as well. And maybe Lee, I know, has been involved in that, so maybe you want to say something about that in a moment as well. And then finally from me, before we talk about our big topic this week, is just to let you know that we've got a couple of new executive directors starting. So Maria Nelligan has started with us in the last few days as a new Director of Nursing, and I know she was absolutely delighted with an event she had with lots of the senior nurses this week who demonstrated and showcased really good practice, so thank you to everybody around that. And Ursula Martin is our new Director of Improvement, is starting with us at the end of September. So again, I'm sure you'll all give them a very warm welcome, and good to see new people joining us. So I now will move over to talking about the really important programme of change we've got. Well, we're on a significant change programme, but particularly about introducing a new structure. And I know that there's a lot of reflections, thoughts, and for some people nervousness around us introducing this new structure. It is really important that we do this so that we can move into working in integrated neighbourhoods, which is very much the direction of travel nationally. A lot of teams are already working geographically, but we really want those teams to now be working in each of the ICP or MCP footprints and really building on MDT working as much as possible. So I'm going to hand over first of all to Russell to just say a little bit about how that whole programme of change is going, and thoughts and views from you. Thank you, Russell.
Thank you very much. For those people who haven't met, I'm Russell Patton. I'm the Director of Operations. I've been in the organisation for 3 months now, and it's been an interesting journey. In relation to the significant change programme that we're going through, as Caroline said, we need to get to a situation where we can prepare ourselves for the future in terms of being a provider of high quality integrated services within the patch. What that means to us is that we need to move very quickly to a situation where we're providing care based on ICP boundaries. So what that will mean for service providers and for individual staff members is that during this engagement process, we'll be exploring a range of options to identify what cohorts of services would be better aligned with each other and where they would sit within the geographical footprint. Now, it doesn't necessarily mean, for example, that everything that's currently provided in Pennine Lancs will be managed by that team within Pennine Lancs. It's more about alignment. So if I can give you an example, children's services, be that inpatient and community services, is under a great deal of scrutiny at the moment and review. So many of you will have heard about the new care models and the way that NHS England expect local providers and local commissioners to work in collaboration to get the pathway more efficient and more effective, and therefore offer a better deal to the individuals that we serve. So that could be an example where we place all of community services under one clinical delivery unit. The most likely scenario, and again subject to full ranges of engagement and consultation, will be locally based services in the ICP areas supported by specialist clinical delivery units. Invites have gone out, and the expectation is that any member of staff can come along, express their views, express their opinions, so that this is a really true co-produced model of care that we adopt and introduce possibly by Q4 of next year. So it'd be ideal that if we're moving into April 2020, that we have the new models in place, and then more importantly, the leadership and management infrastructure to ensure that those services can be delivered in an efficient and effective way.
So Russell, sorry to interrupt you there.
Yeah.
How can people book onto those workshops if they're interested?
Okay, there's flyers have been sent round which will identify where the workshops are during September and October. I'm more than happy if they feel that hasn't been communicated widely, that they could drop me a line or drop Staffside colleagues a line, because clearly this is an ideal opportunity for people to contribute, and I'd hate to think that they missed out because they didn't see a flyer.
So have we got that on the website?
We have that on the
right,
website.
So everyone can go onto the website and find the dates, and can they book onto those workshops through the website?
They can indeed, but
Perfect.
I think what I want to emphasise is that we are a large organisation with a large cohort of staff who are all very busy, so we'll try to show that a great deal of flexibility in terms of if events are full or if it's not suitable for you, if people are on annual leave, there's going to be no restrictions on the number of workshops that we hold. So we'd like to be in a position where during September and probably to the latter part of October that we focus on engagement. As people will be aware, there's a due process to follow in terms of formal consultation, but in my opinion, that comes last. It's about engagement and co-production in the first instance. And obviously colleagues from staff side, I've met with them, I've shared with them my thoughts, and I think although it's very early days, things are looking okay.
I mean, there's been a lot of discussion around this. My name's Lee Morgan, I'm the Staffside Chair person, if a lot of people don't know me. Thanks to Caroline for inviting me here today. I think the stuff I'm hearing from Russell is all very, very positive, and I can't encourage staff enough to engage in the process. Even staff who probably are not affected or think they're not affected, they still have a say, because we've already had a brief discussion with Russell and Caroline about how, although not directly impacted, there's an impact on the wider service and the wider group of staff. So staff side are cited on this. We have been invited to attend the steering groups. We are invited to get involved at every level. But again, until we know the full impact, we wait for the feedback from our members on how it's going to affect them. But we are fully aware of it and involved in communications.
I think it's important to emphasise as well that what we may see is a slight variation on a theme, which identifies that different services are commissioned in different ICPs by different CCGs in a slightly different manner. So what we might see in Blackpool may differ from what we see in Preston, from what we see in Blackburn. And we just need to be aware of that and build on these nuances and build them as a strength.
Yeah.
So that will help us to engage with the third sector, local voluntary organisations, so that we can almost have a real local hub and local ownership of the issues.
Yeah.
And I think that's the benefit of this approach. We have the strength of a large organisation, but the flexibility for local delivery.
Important. So I think we've got some questions or a question.
We've got a question from Janet, Caroline.
Yeah,
we have a question from Janet. It says, we have just gone through a lengthy admin review within the mental health network, which resulted in the Band 6 and Band 5 leadership staff working across more than one locality. Has any consideration been given into how this restructure into locality working will affect the admin managers not only in the mental health network, but CYP and C&W?
So, I mean, Russell might have some thoughts, but my immediate thoughts is come along to the workshops that we're going to be holding and let's hear your views. I can hear that there's been an admin review that had happened, I think, a few months ago, certainly before I started. From my perspective, and I'm sure from Lee and Russell's perspective, our admin staff are absolutely essential, and the work that we're doing with NTW at the moment is going to demonstrate that we might need more admin staff, because we have to get the skills in the right place going forward. But I don't know if either of you've got thoughts.
It's a very valid point, a very valid question, and the staff side are well aware of the recent admin restructuring. We did highlight this on our first meeting with Russell, because we're very conscious about there seems to be a trend at the moment for never-ending restructures, never-ending change. And I just think now we need to have learnt lessons from what's happened in the past and not restructure people for restructuring's sake.
Absolutely.
And I think it going back to what I said earlier on about the impact on the wider the support services and that, which it equally does have an impact. And my concern is about how staff are made to feel. And I think it's important that we learn lessons from the last time. Yeah. And I think we've got a different approach looking at it now. We're more involved, and I think it's really useful to hear about the engagement sessions. And again, I just encourage staff to really get their thoughts known.
And Russell, how are we going to, as we go through this process, how are we going to get feedback from staff around how the process is going? Are we going to have an online Q&As where people can ask questions and we can then publish them, for example?
I think it's important that during these engagement processes we talk about the methodology for feedback. I mean, I'm a big advocate for you said and we did. Now, clearly what we can't give a guarantee is that we'll satisfy everybody, but certainly what we can do is give an assurance that we will seek views and opinions. And I think that should be testimony to me and the senior team who are working on that. Just back to the point about earlier consultation and engagement processes, I think we have to recognise that this is more than a structural change. This affects people's work-life balance. It affects their happiness at work. And we have to do this in the right way so that people feel that they're listened to and that they're involved in the process. Particularly if you look at the admin staff, I've never worked in an organisation that hasn't always had what seems to be a never-ending review of admin services. So we're not starting from a clean sheet of paper. We're doing this review during and at the end of a number of different consultations that have taken place. But I'm very keen that admin staff recognise that they have a real role to play in making the organisation successful. And if I just say it's quite opportune because we're actually talking about the value and the validity of ANC and admin staff at yesterday's executive team away day, because again, I think they can bring a lot more to the party than they have been providing in the past.
Can we just ask then, I think what I'm hearing early on in this process, Russell, when we first met, is about the reassurance that this isn't about saving money, it's not about reducing people's bandings, it's basically to make the services run smooth. And I think last time it was more about sipping, it was more about saving money, it was quite a lot of down banding. Sadly, it was the lowest paid staff in the organisation. I know that's nothing to do with you two people that are here today, but it's the lowest staff that felt the brunt of them down bandings, and I think it's really good that we're hearing that there's going to be investment and looking to recognise the fact that we need more staff and not less.
There's a significant change programme going on across the trust, and we're right in the heart of recruiting more staff around particularly the adult acute pathway. The management of change process for the localities is about us working in a locality model. So I think down at the grassroots, there really won't be that much change in the first instance for this. But there's also a big change programme going on that's probably going to take us a couple of years, which is about us really looking in depth at our clinical pathways and how they are responding in the best possible way to our service users and carers. And that's something we're doing in partnership with Northumberland Tyne and Wear Trust. It's something that will start with what skills do we need to deliver these standards of services across a particular pathway. And maybe you could just speak for a moment about that, Russell.
Well, most people will be aware that we do have a strategic alliance with NTW. They're a very well respected and well regarded provider of mental health, disabilities and neurological services. They're rated outstanding by the CQC. I'm on secondment from that particular organisation, so I have the benefit of knowing some of their systems and processes. What we need to recognise is that they can't come to this organisation and instruct how things will be. What they can do is work with our transformation team and the home teams to look at some opportunities for development, some look at opportunities for change, so that we as an organisation take on board those transformational skills and those concepts and make things better for the people that we serve. So two particular areas that we're working in at the moment is how we can strengthen the bed management service. Most of you will be aware that we have the hub over at Blackpool, and that provides one function. At the moment, it's probably fair to say that we have a number of functions provided by very keen and like-minded individuals. What we haven't got is a robust bed management service with the support of information to enable us to take appropriate actions. So at this point in time, we're asking staff, managers, clinicians to almost work with one hand tied behind the back. So we need to give them, firstly, the skills and the knowledge, but more importantly, the data to enable them to do their work. Secondly, we'll move on to what will be the large-scale change work, which will be in Pennine Lancs. So what's been agreed with our ICS colleagues is that we focus our attention on the secondary care mental health pathway in Pennine Lancs in the first instance, to basically run through a patient's journey from the point of contact right away through assessment, through treatment, and hopefully through to discharge. As Caroline said, this is a significant piece of work. It's not just in and out in a couple of weeks. This will be significant co-produced work with service users, carers, GPs, police, everybody who touches our services. And actually, that's a lot of individuals and a lot of stakeholders. So we're probably talking about a 12 to 18 month programme, and what we learn from that, hopefully we'll pick up and where possible, drop in the other ICPs within our patch.
So I think that's really, really helpful. Hopefully you found it helpful. Different ways that you can get involved. You can come along to the workshops. Russell's going to make sure we've got a feedback system set up. We've got a working group that Russell's chairing that will feed into the execs and the trust board. So we really, really would appreciate your thoughts and views. I think that's probably come to the end of our time. Our next chat with Caroline, really important area, which is going to be around how we engage with service users and carers. And Maria Nelligan is our new Director of Nursing and lead for this whole area, would be joining me, and hopefully with some service users and carers as well. So thank you very much indeed.
Thank you.
Thank you. Bye.